Hey guys, Don here. Welcome to the $1 Million Minute. This is Don with Podiatry Practice Mastery. So I'm going to go over, this is kind of a bomb of a day. I'm not exactly sure what happened. Sometimes in New England we have I don't know if it's a snow day or a cold day or staff just forgot to schedule me. So I had 13 appointments and 3 hours of time. I don't know if this ever happens to you, but this happens once in a while to me. And it's kind of frustrating. You kind of get a little on the edge, and so I try to make the most of my time when I have this extra time. What I've been doing lately is using an app called Submagic, and I was editing videos. I know that sounds funny, but I make little YouTube shorts and I edit them in my spare time. So I try to keep myself busy. Otherwise, I tend to stress out my staff. But so that's what I was doing. And also, I had a talk during lunchtime. I did an interview with Grace. She has a direct care kind of model practice, which is kind of interesting. Does not take any insurances. If you look at her fee schedule, I think it's about $250 for the first consult, and then you pay for a la carte for other types of things. It's not the per month model that a lot of the primary care doctors do. It's just the a la carte model. I liked it. I thought it was an interesting interview, so that's on my podcast if you want to listen to that. And then finally, I had a talk during the day with Alleviate. I was having a hard time integrating Alleviate into my regimen. What is Alleviate? Alleviate's a new product that's out there. It's like a piece of plastic that's used to do a Graston on the bottom of the foot and the back of the calf. So deep tissue massage to help with plantar fasciitis. They kind of quote that you can treat physical therapy without a physical therapist. That's kind of their thought. They also have kind of an ankle brace that has a stirrup around the arch, and they also have compression socks. They have this little kit. It's about $200, and I was having a hard time offering the kit, and I think it's because I'm stuck in my method of offering foam rolling, morning splint, and night stretch or night splint that you've heard me talk about over and over. And I was talking to this person because I feel like $200 is a little bit of a hard ask on the first visit when I'm just meeting someone. So what the company person kind of recommended was offering it at the second visit. And I kind of like that idea, kind of offering first visit, keep doing my same thing, which is easy, and then when they come in for the second visit, depending on how they're doing, then say, hey, I'm going to do the ultrasound, we're going to do the shockwave, let's say 3 or 6 sessions, and then during this time, I'm also going to have you use this Alleviate deep tissue kind of Grastoning tool for 3 minutes twice a day, and they can just kind of sit down, do it, and it has the other things, but the benefit to it is I'm starting to do less physical therapy. I got this actually when I was at the recent Shockwave conference. I'm going to be doing less physical therapy because I'm not sure everyone really needs it, and people are kind of getting better without it. And this is a way they can do their own home PT. So I'll give them the option. You can either do PT, which is 6 weeks, twice a week, so 12 visits. Probably ends up being about $600 if they have a $50 copay. Or they could do this Alleviate thing, which is like $200. And they can do it on their own at their own convenience. So that's kind of that was my work through on this, and I'd like to put this all on my one page. So I have this one page that really makes it easy for me that I do for nail fungus. It has like the first visit and then the follow-up visits. And I'd like to put this on a one-pager for my patients for plantar fasciitis. And so that's what I'm going to be working on. If you want either of mine, the one I use for nail fungus or plantar fasciitis, just shoot me an email, don@podiatrypracticemastery.com. Just tell me what you want. I'm happy to share that with others, and it might help your practice. Okay, let's go into the day. I spent some time here because it wasn't a very busy day. So I had a patient came in. She was really sad, crying. Her CaryFlex fell off, and I don't know if I put it on bad or it snagged her sock or something like that. But I put another CaryFlex on. I only charge an office visit when it falls off, so I tend to guarantee my CaryFlex for 3 months. Then just so you can feel the pain here, how I felt yesterday, I had 2 free slots, edited videos. Next patient canceled. This was an EPAT. Canceled. She was supposed to be on the first MPJ EPAT, so you're feeling my pain here. And then a patient came in. This was a 76-year-old man. He was here for an orthotic follow-up, and he was really pleased with his orthotics. I gave him that, and I did a video because he liked them so much. So I'm just using my time for videos now when I have this free time. And then I did a second pair. He wanted a second pair of orthotics. And the conversation that I learned from someone else when I talk about orthotics, and this is something I think it's good to kind of position yourself. I do this for both shockwave and I do this for orthotics. So with shockwave, I'll say, you'll probably need, if you've had pain for over 6 months, you'll most likely need 6 sessions of shockwave. I usually start by scheduling the first 3, and then we can add the other 3 afterwards. Because I think making 6 appointments is a lot of appointments to make. So that's kind of the wording I'm using. Instead of doing 3 and then a 6-week follow-up, or 6-week break, as you may have heard me in this past. Same thing with orthotics. I'll tell patients, you're going to be getting orthotics. A lot of my patients do 2 pairs. So this is the words that I use. I don't care if you get 2 pairs or 10 pairs, but I find that by having a second pair, you're more consistent using the orthotics, so you don't have to move them from shoe to shoe. So they can do 2 regular pairs, they can do kind of a regular pair and a dress pair, and that second pair, I give them a big discount. So I kind of preface that when they're getting the orthotics, so they kind of know that's the plan. So I'm hoping that will help more of them get the second pairs. Another patient came in, 67-year-old female. She had posterior tibial tendon dysfunction with a tendinitis. Quite a bit of pain on the left side. So since she was in so much pain, I'm going to start her with a walking boot to kind of rest the area. Then when she comes back with icing, meloxicam, contrast baths, and then when she comes back in about 3 weeks, then most likely I'll do the shockwave at that time, kind of switching with doing an ultrasound and then a shockwave. Another free slot. Next patient was EPAT number 4 for the Achilles tendon. So her Achilles was feeling a little bit better, but not totally better. So we're going to do 4, 5, and 6. Many times I find that these insertional Achilles need more shockwave sessions. Another patient was a 76-year-old man. He had some balance issues, some foot issues, and scanned him for orthotics. Next was I had a telehealth. I very rarely have telehealth, but this was a telehealth. Did this for a gentleman who was in Florida, and we did a Lamisil booster for him. Another open slot, feeling the pain here, was a 68-year-old patient. She came in, she had Raynaud's, and so I kind of went through the whole Raynaud's thing. This is pretty common. I did a video on Raynaud's recently with patient. And then what I did for her is she had some porokeratomas. She thought they were warts. I treated them in the past with lesion destruction, basically salicylic acid with an aperture pad. But then this time what I did is I excised them. So the way I excise porokeratomas, you do them as a kind of a lesion, excision, and call it a neoplasm or some type of a skin growth. And I usually do a 2 millimeter punch. So I'll numb it up with 1 cc, light it with epi, and then I will punch it out, and I'll see them back in about 3 weeks. Okay, that was the morning. Afternoon was a little bit worse. So this was a patient, 69-year-old patient with a partial nail avulsion. There was another new patient that had some 4th toe pain. She had some hammer toes and calluses. Another patient that came in, she has first MPJ arthritis. So she was here for a surgical consult, so I referred her to one of my colleagues here that will do a first MPJ fusion on her. Another patient was a 43-year-old man, Lamisil follow-up. And then finally, there was a gentleman that was here for a wart follow-up, and then he was all better. He had a little kind of wart/abscess. I find some of these warts, or people that think they're warts, they use salicylic acid, and then they create an abscess underneath it. So I had a patient like that. That was one of these. They had a callus, and it created an abscess or an ulcer, and I debrided it. And thankfully, there was no infection. So that was the day, and I left early at 2 p.m. And then, if anyone is curious, then I went and tried to find a New York Yankees hat for my son, but I couldn't find one. He's got because they only have fitted ones at Dick's, so I'm trying to get one with these adjustable backs. And then I went to their taekwondo board breaking, and so I enjoyed the afternoon with the kids. And then the other thing I signed up for, I have a friend, he coaches people on shockwave, and so I'm excited about doing that. He is in England, so I've been reading or listening a lot to this guy named Alex Harmozy, and he talks about buying skills, and I think this is something that's important. I feel like I'm very good at shockwave, but I want to get even better. So 2 skills I want to buy is learning to even do more or do shockwave better. So I'm paying him. I think it's about $500 an hour. I'm going to do 6 sessions with him. And then there's another guy that does kind of email marketing, like newsletter type of stuff. So I'm going to pay him to help me. So I'm trying to pay to buy skills to get better at certain things. So I think that's something that's key. Is if you're not very good at something, you can read all the books, but I find it's a lot easier just to pay someone when we're at this phase of the game. In terms of you have more money than you do time. Sometimes it's easier to do that. Anyway, those are the rants for the day. Thanks.